The Reach Out and Read program is an innovative and evidence-based early learning model. Pediatric providers use this model to engage families with children's books during well-child visits, from the 6-month visit to 5 years old. Reach Out and Read is expanding in Illinois. Let's hear from pediatricians across the state about why it's working, why they support it, and how you can help the Reach Out and Read Illinois program thrive.
The Illinois chapter of the American Academy of Pediatrics houses Reach Out and Read Illinois' program. And with our access to thousands of pediatricians across Illinois, we're able to connect and network with pediatricians and support them in their implementation of the program.
It's really an amazing way to engage patients in care. It's an amazing way to assess development. It's an intervention we can really provide meaningful interventions through the Reach Out and Read program. The support that we have received from Reach Out and Read first starts in our site. It's important to have a committed team in each site that can be a link between the sites and the Reach Out and Read Illinois program. And Reach Out and Read Illinois has been super responsive to our needs. When we need books, when we need donations, when we need anything that we need from the program, we have been able to easily reach them, and they have been super accessible and super willing to help us out growing our program.
We opened our clinic in 1996, and we started our Reach Out and Read program in 2002. And since then, really, it's become an integral part of everything that we do, our decorations, the training that we do for our physicians, what we talk with our patients about. Really, books are key to the work that we do here in this clinic. Nobody has to convince pediatricians about the benefits of this program. We can see it. We can feel it. We know when we walk into a room and we give the book to the patient, everything lights up. The kid's smiling, the parent is excited. The relationship between the pediatrician and the parent is just, you can feel a connection. The parent feels like this doctor cares about my child, not just about their ears, not just about their health. She cares about my child's future. And that is, it's irreplaceable.
Reach Out and Read embedded into care can definitely help better health outcomes in communities, and they're going to be helping so many families and so many children continue to foster the love of reading for a lifetime.
Our literacy message for Reach Out and Read starts at the very beginning of the visit. As soon as they walk in, they see our brand, our logo that has a book on there. And that message is continued in the waiting room, where we have shelves full of books that they can read while they're waiting for their exam. During the exam, they get a book to take home. Reach Out and Read helps develop relationships with families by using the book as a bond. We give them a book. It's something to remind us about the visit, to read every day with family members, and it's something different that other physicians might not be doing. So Reach Out and Read helps create a more positive experience by giving those opportunities for those teachable moments.
I know Reach Out and Read is working in Illinois because the studies show us that it works. So for the last 30 years, the Reach Out and Read program has been the most studied nonprofit program. Reach Out and Read Illinois the studies have shown that parents that have the program read with their kids 2.5 times more than parents that go to clinics that don't have the program. And you see kids running into the clinic so excited to get their book. Kids are actually excited to go to the doctor when a clinic has a Reach Out and Read program, instead of being scared to go to the doctor when they don't. We see that the program works.
There are book deserts across Illinois, so some of that is in rural communities where there just might not be a library within a few miles or even in the district. But then there's also transient families that are dealing with homelessness, or low-income families, or families that are migrants. All of these different populations have their own struggles with acquiring books. And the program itself is universal, but we have worked really hard to intentionally expand to communities where there is lower book access.
You should be able to have access to the same program, the same books, and the same fidelity as well as any kid.
Books are not cheap, and board books for young children are not cheap. And a lot of families that want to provide the benefits of reading to their children cannot afford to do so. So not only are we helping families out financially from that perspective, but a lot of times parents don't 100% know what to do with the books past reading them. And the nice thing about the program is it provides a lot of education to providers in a pretty quick, easy to do training session that allows you to have the information to share with those families on how to make that reading time most effective. So the Illinois team is amazing at providing support, especially when you're first opening the program in your clinic. All you have to do is ask, and they will get back to you with a checklist of exactly what to do, how to do it, how to find funding, and any questions you may have.
I think it definitely helps to have that support system just to take that first step. And I strongly, strongly believe that together we can make a difference in the lives of many children.
And I think that having that human connectedness with clinic providers really helps boost that ability to meet families where they are and help them get to where they want to go.
The reward that you get from using Reach Out and Read is priceless.
You don't think about it when you're seeing your patients that maybe you're actually also impacting their future kids.
There is nothing like the joy of being able to see a smile on a child's face when they recognize that you are going to be giving them a gift, and that is what it is to them.
It is really impactful, and I hadn't realized until that point quite how impactful it was going to be.
And I will never practice without Reach Out and Read in my practice.